Hello, everyone. Today, we're going to learn how it's possible that Alzheimer's disease is actually preventable and even reversible. I'm Penny, and personally, for me, thinking about or hearing about anybody who has fallen prey to the devastating disease of dementia is just heartbreaking. To know or to even contemplate that as we get older, we could possibly lose our mind and our whole sense of self and reality. It kind of makes you feel like you don't want to even get there. Today, I'm talking to Dr. Whitney, who for the past 10 years has been offering advanced prevention of heart disease, cancer, and most recently, dementia to his patients. He's also on the teaching faculty of RECODE, which is the course to certify physicians in the process of prevention and even reversing dementia. So, hello and good morning. How are you today?
Doing wonderful, Penny. Great to talk to you again. Really, truly excited about this topic. I mean, I've been doing prevention my whole career. And when I discovered the possibility in dementia about 4 years ago, it really is what kind of helped to juice me to the next level of preventive care. Because people don't feel the heart attack that they're going to have tomorrow, but most people feel in their 40s, 50s, or 60s, they feel the memory changing, and it really worries them about what comes in the future. I mean, like you said, I don't mind getting older, but don't steal my brain.
Exactly. It's so true. And to hear that these things can be prevented and reversed, I think it's just instantly offering that,
Yeah,
that.
absolutely. I used to tiptoe around the subject because, I mean, most of us realize that when somebody gets the diagnosis of Alzheimer's disease, it's terminal disease. There is no treatment for it. Any of the treatments are just at slowing the progression, not reversing or anything of progression. So I kind of hoped that what I was doing in heart attack and stroke prevention and other healthy guidance on people would do the job, and it does to some level. But when I discovered this, it was a game changer.
I can imagine. So could you tell us and give a little bit of an explanation about what the difference is between normal aging, dementia, and Alzheimer's disease?
Certainly. So first of all, let's kind of distinguish dementia and Alzheimer's, that people get confused about the two. I pretty much use them interchangeably because dementia is just an umbrella term of all types of memory loss. Alzheimer's is about 95% or more of dementia. There are other subtypes also that can be distinguished, and we do that at the beginning of the progress to make sure it's not something else. But for the most part, most dementia is Alzheimer's disease eventually. As far as normal aging, it is normal to lose some brain functioning over the course of time. There's different variations of it. We all have heard of those people in their 90s or even 100 Charcot's attack. Most of us aren't so fortunate to go that route, but a little is normal. But there is a pattern that if you hop on the curve, the train of Alzheimer's, that accelerates as time progresses. So the earlier we can catch it in the process, prevention's the best, but the earlier we can catch it in the process, the better chance they have at turning around before they've lost too many brain cells. Functionally, that's what happens is we lose the functioning of the neurons, our brain cells that allow us to think.
Okay, thank you for that. So I know a lot of people in their 40s, 50s, at 60s, and even above begin to experience the kind of senior moments where the brain isn't functioning as well as it used to. Who should actually be worried?
So again, it's not a sentence to Alzheimer's if you start losing a few words here or there. Having a little difficulty remembering names, remembering some words does not mean you're on the path to Alzheimer's, but you don't know. So that's why it's you need to interact early. So the people I target most for the preventative program are the people who, number one, have a family history of dementia. That's an important component. There are lots of genes that play into dementia, but there's one in particular that it's easy to check. I check it on all my patients, and you can catch it, you get it on the 23andMe and other kind of off-the-shelf genetic testings that you get. It's called the ApoE gene, ApoE. And if you get your results and you're a 2, you can be really happy because a 2 is unusual, but it reduces your risk of dementia in your lifetime. A 3 is what most of us have, but 25% of the population is an ApoE4, 1 or 2 copies of a 4. That basically, if that happens, there's a 25% chance if you got 1 copy of the ApoE4, and a 50 up to 90% lifetime risk of Alzheimer's if you're about the 1 or 2% that have 2 copies of the 4. So that's actually one way you can really risk stratify yourself on your own to do it and act accordingly. Now, it's not a sentence again. If you have the ApoE44, just statistically, if you don't do anything about it, then you've got a 50% chance of not getting it. And I think that any ApoE44, if they begin before they start getting symptoms, have the opportunity to be in that 50% who never have Alzheimer's disease in their lifetime. So again, everybody should be looking at preventing and think about those senior moments to get healthy, but particularly the people with the family history or the ApoE4 gene.
Are there any other kind of common factors that play a part in people being diagnosed?
There are lots of contributors to Alzheimer's disease. That's what this program is all about. If people are not sure if they should be concerned or not, there is a tool I use in my practice called CNS, Central Nervous System Vital Signs, CNS Vital Signs. It's actually a pretty good cognitive test that people can just do. That will help to kind of give them a deeper dive assessment. They do about 40 minutes of questions, and it kind of takes a look at their cognitive abilities. So there are opportunities to test, but mainly it's just really everybody ought to be kind of, if you have a few senior moments or challenges, to think about doing a preventive mode for it.
Brilliant, thank you. How is Alzheimer's disease currently treated?
Well, that's sad. That's why I've been tiptoeing around the subject for so long, because typically if somebody comes in with some memory concerns, then what we'll do is we'll order a few tests to make sure it's not their thyroid or B12 deficiency, a couple things like that. Even when somebody has Alzheimer's, the number of tests that the neurologists do are sadly limited. We'll make sure it's not other conditions like dementia. Depression. Depression can mask itself. It's actually called pseudo dementia. You treat somebody for depression and their memory gets better. So that's one thing, especially if you have a parent or an older relative who seems to be having problems, make sure they get checked out. It could be that.
Wow.
And then if I have a suspicion that they're going down a bad path, I'll send them off to a neurologist just to make sure that I'm on the right path, and frankly, to get someone else besides me to break this news to the patient. Generally, traditional approach is to give people medication. There's 2 or 3 medications out there, others in the pipeline, but not terribly promising. But the medications, as I said before, they don't reverse anything. They don't stop anything. They just slow the progression. So the medications are very limited. And unfortunately, I sent a patient in this circumstance to a neurologist a few years ago, and he came back and I said, "So how'd it go? How'd your visit go?" And he said, "Well, he said a lot, but the only thing I really remember him saying is at the end is to get my affairs in order." Because unfortunately, the neurologist knew that there was not a lot that he could do about it. And unfortunately, this patient, imagine leaving a specialty visit with zero hope and to get my affairs in order. That's why when I knew lifestyle approach to dementia was going to be valuable, but when I discovered this approach, it was really exciting because there's so many people we can help.
Talking about the lifestyle approach, how is it actually possible then that dementia can be prevented and reversed?
So it goes back to the development of this program. You mentioned earlier, RECODE is the name, RECODE, stands for Reverse Cognitive Decline. And it was a program developed by a neurologist, a UCLA neurologist. And he set off on his career to cure Alzheimer's disease. So for the first decade or so of his career, he was in the usual route of trying to develop that magic drug that was going to help them out and reverse dementia. And he was getting frustrated. And the positioning that he had, that I believe was his total success, is he married a woman who was a family physician like me, a functional family physician like me, where we look at the root causes of disease. So she basically told him, hey, Dale, his name is Dr. Dale Bredesen. Dale, if you can just go and do the research to discover all of the root causes of Alzheimer's disease, develop a program to address the root causes of the disease, then you might get somewhere. So, like a wise man, we listened to our wives, and he did that. He did that. He went out and he discovered, he researched all of the different root causes. He describes that there's at least 42 root causes. He projects that somewhere by the end of the discovery, there'll be 50 to 70 root causes of Alzheimer's. And that basically he set up a program. And in 2014, he published his first article about it, and it was working. I mean, it was getting people better. So in 2017, he published his work in a book called End of Alzheimer's. It was a New York Times bestsellers. He has all of the physicians in the root cause functional medicine world who that support his program. I mean, he's really become a prominent player in the preventive medicine world because it works what he does and it makes sense in what he does. And then in 2017, he started training physicians like me in the process and restarted his training process last year. And we have, like you mentioned, I'm on the teaching faculty with him, and we've trained over 2,000 physicians around the country in his methods. And it's growing all the time. So it's very exciting. And actually it is soon to be published, but I just heard a couple of weeks ago that he's got data out there that in people who are fully engaged in the program who have memory loss of early Alzheimer's or mild cognitive impairment, 80% of the people improved.
Wow.
80%. So they didn't just stabilize. Their cognitive testing actually showed that if they engaged in the process, they actually improved some. So, I mean, those are phenomenal numbers, unheard of in a world where we just hope to slow the decline.
Can you repeat the name of the guy in the book as well? Because I think that was...
Yeah, it's Dr. Dale Bredesen.
Dale Bredesen.
Dale Bredesen, and it's End of Alzheimer's. Easy title to remember. He just wrote it. That was honestly geared more towards inspiring physicians. That's honestly what inspired me. I had a patient tell me about the book published, and I read it, and it was like so similar to the heart attack and stroke prevention program that I've been doing for over a decade now. That's been extremely successful. And it was the exact same approach. It was looking at the root causes of disease and finding out from them. And then he's just published his second book last year, End of Alzheimer's, the program, which is more geared towards the average person, where it kind of gets into the more nuts and bolts of what you can do about things when you have a problem or you want to prevent a problem.
That's amazing. You said that there were like more than 50 root causes. So does that mean that there's a variety of things that you can start to focus on, change, implement that would work towards prevention then?
Without doubt. And actually, when there's 40 to 70, there's at least 42 up to 75, that can overwhelm somebody, but because there is a lot of things that can be done. But how we work the program is we gather all kinds of data from imaging to blood work, urine testing, saliva testing of the mouth, because oral bacteria issues could play into the disease. So we gather a bunch of information, lay out all the data on a spreadsheet, and that gives me an opportunity to take a look at it and figure out where is their problem. Dr. Bredesen in his books breaks down the contributors into 6 different categories. There is general inflammation. So you hear of inflammation, which we use to fight off cancer cells, infections, toxicities that come into our lives. But if it never turns off, then inflammation is disease causing, heart attack, strokes, and dementia. So there's inflammation. There's deficiencies of hormones and nutrients. So we look at a lot of hormones and nutrient levels. 3 is toxicities. So we're all exposed to toxicities in our life. And if certain things, whether they're heavy metals, mercury from amalgams from fillings in our mouth, The bio world, mold, Lyme disease, others, those toxicities play into it.
Yeah.
Cardiovascular disease is a big contributor to it. So that's why the heart attack and stroke program played into this one beautifully. And past trauma. So past trauma will set people on a path towards being at higher risk of dementia. And those are all actually just contributor categories. The one diagnosis on the list is diabetes and prediabetes. It's such a big contributor that it gets a category of its own in the process. So if anybody's has diabetes or prediabetes, that they're already having a significant contributor to memory loss over the course of the next years or decades. So we basically gather it all, put it in those categories. I sort out what's there, what is needed. And then we come up with a plan based on how motivated the person is. Some people want to do everything. Some people want to do as little as they need to. How certain things are really difficult to implement, and other things are easy piece of cake to implement. So we just kind of play in all those different variables from motivation to ease of implementation and need. We come up with a game plan, and I do that based on the individual. So that's the bird's eye view. Can't even get all the weeds of details of it, but that's how the approach is done. Very practical. It's a very practical approach.
And it sounds very tailored to each person. I love the fact that, because for some people, just knowing if someone's got to a certain age and they haven't been able to implement certain lifestyle changes, I'm guessing it's going to be a bit harder, but knowing that people can start small and you tailor it to everybody is just so encouraging.
Yeah, without doubt. It's the people who notice the most improvement in this program are the ones who have mild cognitive impairment, so they're not bad enough to have diagnosis of Alzheimer's, or those with mild Alzheimer's disease. So it really does require, when it's on the fast pass, I mean, the glide slope, when you've gotten into mild cognitive impairment, is fast. It accelerates as time goes on. So it really does require a full court press. So the program I put together for that is the full boat one that he's done and shown to be so successful. It involves health coaching, it involves educational platform, it involves frequent doctor visits and health coaching. I mean, over the course of a year, people in this program end up having a doctor's visit or health coach visit every couple of weeks or so, because it really is important, but it's doable. I mean, it's absolutely doable. And that's where it's, so just doing it casually. What?
It's so worth it.
Yeah. Oh, very worth it. I think it's a terminal disease. So it's a all in. It's an all in, and it's a full court press, whatever word picture you want to use. But usually the families get involved, but actually it's fun because the families enjoy getting involved because they're going to help themselves too. Because you imagine, it's usually going to be a child who's helping out a parent who's having problems, and inherently the child's at risk. So in the process of helping support the parent with their visits and things, they're going to help themselves in the long run too. Because as opposed to it being, in order to reverse, that's an important distinction to talk about, is in order to reverse, it does require a full court press. And it's really kind of for the first year or two, it's kind of, that's the main focus of health. If there's no other major health problems going on, in many cases in dementia patients, there aren't any other major health process. The program works the best, intuitively, again, it makes sense, in people who don't have problems yet, or maybe just have a few senior moments and they're at risk, because the earlier you catch the problem, the easier it is to turn around. And if somebody is at risk or has a couple of senior moments, then it's doesn't need to be so aggressive. So preventing cognitive decline. So Dr. Bredesen coined a new term, pre-code. The other reverse cognitive decline is recode. Pre-code is prevent cognitive decline. That's infinitely easier because you don't need a full court press. You can if you start over the course of 5 years, perhaps implement what's necessary one at a time. Again, starting off with the most important and the easiest to do, and then just kind of executing the plan more slowly over time. So you can work it into a busy work life, a busy home life, and things like that, if you catch it early enough and don't have to get aggressive.
Brilliant. Thank you. Thank you for going into so much detail. I know for myself, and I'm sure many people watching this, some of this stuff just, you just have no idea until you're here, and then you're like, crikey, why is this not something that, you know, I know about or my family know about? And I think one of the things that stood out to me as I've been hearing more about dementia is that, and it's really, really sad to say this, but a lot of us, including myself at one point, had this kind of stigma around elderly people, that all elderly people are a little bit forgetful, or, you know, there's kind of like an image that we have. And I think it might be built from the fact that the kind of older people that we're around are all unwell to a degree, and we don't really know, because we assume that's just how old people start to behave at some point. And so everyone kind of accepts that that's what's going to happen when they get old, or when their mum gets old. So they never realize that they can play a part in preventing it and helping them. You just kind of accept that this is how it is, just through lack of knowledge. So hearing you speak about dementia in the short time that I've known you has helped me to understand that not all older people go through that decline that I pictured in my mind as just everyone.
Even if you're genetically at risk, it's not necessary. And actually, one of the reasons you've sensed that, maybe even in yourself, is that it's scary, because most people realize that until now that there's nothing to be done about it, and therefore we cope with the scariness of it by sticking our head in the sand and kind of ignoring those senior moments as best as we can, not realizing it's something we can do about it. But the good news is that the tide is beginning to turn. People are beginning to recognize it. Back in 2019, there was a professor from Harvard Medical School who published an article talking about that lifestyle actually can work towards preventing dementia. And Time magazine actually that same year dedicated an entire edition to Alzheimer's disease. And one of the words they used on the front cover was hope, because that's what this gives people, is hope. Whether they're having senior moments or whether there's got a family history, there's hope for a good future with this. The sad part of that Time magazine is I got all excited, this 100-page or so edition of it, special edition, and it was almost all about genetics and medications they were looking to develop, because that's another nature of American medicine, is that we think in terms of reacting to disease, in terms of when somebody gets the disease, react with this medication or that medication. That's just how our culture has been for, 60, 70 years now.
Yeah.
It's like the 50s. But in kind of tucked away in the middle of this edition was a segment that was talking about lifestyle. One article talked about lifestyle. They didn't put it out there, but if you read and knew what I knew in reading the article, you could see that that was the only intervention that actually seemed to make people better. And the more comprehensive it is, the better people are going to get. And even if one of the questions I often get is, well, what if somebody's got pretty bad Alzheimer's? Can they do anything about it? Well, once you get into moderate or severe Alzheimer's and have had a lot of loss of brain cells, it gets a lot more difficult. But you know what? Quality of life is critical. And if you got someone who's down in severe Alzheimer's and they get up to moderate Alzheimer's, just that quality of life is terrific. Keeping yourself out of an assisted living. I mean, you know how just financially beneficial it is to keep out of an assisted living or a memory care center. I mean, I did some research, and at least in my area, memory care centers are pushing $8,000 to $10,000 a month to do that. And if you can just save a little bit of time out, that it can be financially devastating for families when people they get severe like that. So it's really, really rewarding to watch people.
Thank you for what you're doing and how passionate you are about this, because it's definitely opening up a lot of people's eyes and improving the quality of their life. If anybody is watching this and they're thinking, what is this program? I want in. I want my mom or my dad, or, you know, I just want to access this program. How do they do that?
Oh, certainly we offer it. We actually have people who fly in to do this. As you can imagine, there's not many places around that do a comprehensive program like this. So right in back of me, Revolutionary Health Services, my practice. Website's rhslivewell.com. Got some information on there, but it's we have the preventative part of it, we do in all of our routine patients. And some people come in just for a fly-in program because we've created a program called Health Compass to 100. Health compass, like a compass, like navigating, to navigate your way to that healthy 100th birthday. We incorporate the dementia prevention and go a little bit deeper if somebody does have a risk for it or having some of those senior moments. We do the preventative cognitive decline in it. And then we have the bigger reversing cognitive decline that involves the health coaching, the frequent visits, the full court press testing, and that we do that for people who are actually having problems. And we can do a lot of it through telehealth. Do have to have at least the first visit being in person for all the testing and all that, but we have to. But basically, yeah, we have the opportunities to help people out, and there's others trained out there also. But I kind of humbly like to say that they may be as good, but I really think we've been doing this for about 3 years now, and it's fun.
Thank you so much. Is there anything else that you would like to add?
There's no important investment of your time, effort, and money than your health, because if you don't have your health, you don't have much at all, and it can change on a dime. So getting into kind of true prevention to prevent the heart attack, prevent the cancer, truly prevent the cancer, and to prevent dementia, that's the most valuable thing you can do for you and for your family.
Brilliant. Thank you so much. I look forward to speaking to you again soon. And yeah, we appreciate you.
Thank you.